Welcome to Adapting Quiz. If you're struggling to calculate heart rate on the EKG strip, stick around. This is a simple, straightforward video to help you master the calculation if you're in nursing school or you're planning to take your NCLEX. First, you have to know key facts, right? This is a simple EKG. Every EKG should have a P wave, which is the depolarization of the atrium. We don't have repolarization of the atrium, and therefore we have no sign indicating that. It may be within the PR interval. And then you have QRS. So this is QRS. That is the depolarization of the ventricle, followed by repolarization of the ventricle, and that is the T wave. And this repeats itself throughout the cycle. If it's a regular rhythm, check the distance between one hour to another hour. So this is hours. How would you know this is a regular rhythm? See how many large boxes. This is one large box. This is one large box. There's a tiny one. 1, 2, 3, 4, 5. These are smaller boxes. When we say large boxes, we're talking about these thick lines. The smaller boxes are small. So there's 5 small boxes between 2 thick lines. So count how many are there. There's 1, 2, 3. From here to here, how many are there? 1, 2, 3. And you can see it's uniform. 1, 2, 3. That means this is a regular rhythm. For the heart rate, if it's irregular, you will see that you won't see the thick boxes between 2 hours. It's going to be different. How do you calculate the heart rate is based on what kind of method you want to use. The first one, we use it for mostly regular rhythm, right? It's very good for regular rhythm, and that is what we call the 300 rule. So you use it for regular rhythm. I'm talking about the 300 method. The 300 method is not that difficult, but you have to pay attention to. Since you know the EKG and you know this is a regular rhythm and you know this is R wave, 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 this is R wave. What do you need to do? Find 2 consecutive R waves. It does not matter. So far as it's a regular rhythm, you can choose this R wave, the distance between this, or you can choose this one. If I'm choosing this, so this is 1 hour, 2 consecutive. Don't jump the next one. So this from here, how many, okay, large boxes are between? Large boxes, I told you, is this thick one. So from here, 1, 2, 3. You see, there's 3 large boxes. Same thing from here to here. 1, 2, 3. So there's 3 large boxes between 2 hours, 2 consecutive hours. Therefore, how do I calculate the heart rate using this method? I take the normal, the 300 and divide it by the number of large passes, which were what? 3. And that will give me 100 beats per minute. That's your heart rate. If it's a regular rhythm, 300 method, this is the way you calculate it. If it's either irregular or it's regular and you want to use another method, it's called what? That method is different. That is the 6 seconds strip rule. That's 6 seconds strip method. And this can be used for both regular and irregular, right? Regular and irregular. Irregular means the distance between 1 hour to another hour is not going to be the same, but you can use the same method. There's 2 things they may tell you. One, if they tell you it's a 6 seconds, yeah, they may tell you it's a 6 seconds. So that means you're lucky. Hey, this is a 6-second strip. If they don't tell you it's a 6-second strip, you make up a 6-second strip. How do you make 6 seconds strip? Is to count 30 large boxes and then use it. So what do? We're going to count 30 large boxes. Remember, I told you these are the large boxes, right? The smaller boxes is in between. So this is 0, 1, 2, 3, 4, 5, 30 strip. Calculate from here all the way. It will give you 30, right? You've got that. So we know from here, 0 to here is 30. Now calculate how many R are within the 30. There's 1 R, there's 2 R, 3, 4, 5, 6, 7, 8, 9, 10. So there's 10 R within the 30 boxes, right? 10 out within the 30 boxes. So what do you think you should do? 10 hours within the 30 boxes. So this is the key. People get confused with it. So what do you think we should do? We have 10 hours within the 30 large boxes. All you need to do is to remember to multiply by 10. And that will also give you 100 beats per minute. That's all. So to recap, to use the 300 method, use it for regular rhythm. And for regular rhythm, take 1 hour to another hour and make sure the distance are the same. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. Therefore, I know this is a regular rhythm. Therefore, if I want to use the 300 method, I just count how many tick boxes. 1, 2, 3, 1, 2, 3, and divide it by the 300. That's all. If it's irregular, or you want to use this 6-second strip, irregular like AFib, yeah, count 30 large boxes. So we have 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We have 30 of them. Therefore, I know this is a 6-second strips, and I know I can use this. I can use the 6-second strategy, and I'm going to put all my information within the 30. So out of these 30, don't go beyond 30. Out of these 30, how many hours are inside? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and multiply by 10, and that will give you 100. If you worry about the R you can say is the same thing as QRS complex, because you're just counting these numbers. That's all. QRS complex. This is the way to calculate heart rate. Take care of yourself and have a good day. If you need more, subscribe to Adapt NCLEX and learn more content like this. Take care of yourself and good luck.